Are they just pricing doctors out? Is this a deliberate strategy? These numbers are too small. $20 a visit or $20, it's crazy. This is absolutely crazy.
Well, they thought they had everything worked out on the front end of this whole deal, Larry, and you know what a disaster that's turned out to be. But I don't think they had any idea what they were going to do on the back end. But no one thought we were going to get more money from this. We were all thinking that this was going to be, as if you remember, 2 months ago I said this was Medicaid plus, a slightly better reimbursement than Medicaid.
There is a long-term trend here, if I'm not mistaken, both for Medicare and Medicaid, to keep slicing and slicing and slicing down. Hospital reimbursements, doctor reimbursements. This is part of that trend. Why? Why won't they reward doctors?
Basically, they compare the price of physicians in Europe to the United States, where we do get more money. However, they get free medical education in Europe. They don't have the tort issues we have here with unreasonable medical malpractice suits that increase the cost tremendously. And the training is much longer here. It takes us an additional 8 years of cost and very poor incomes before you actually go out and start a practice.
How much is this going to knock down the pool of doctors? Let's say this stuff goes through. How much will this take down the pool of doctors?
We're already 15,000 doctors shy of primary care specialists that we need. And this will eliminate many, because I think a lot of will go into concierge practices, realizing that quality of life is better than maybe how much they make. And there'll be other people who just say, I'm going to retire early.
Now, one last thing, I'm going to get my panel on this too, but employer-based plans pay a little better. Is that true? Is that fair, employer-based plans?
They do. They pay a little bit better, oftentimes a little better than Medicare, and sometimes a little worse.
All right, we're going to go. Heather Higgins, what do you make of this? What's going on here?
Nothing that one couldn't foresee, unfortunately. The problem of physician shortage was already predicted to be acute, and this is going to make it worse. This is just one more form of redistribution, and it is one more example of the antithesis of that JFK wonderful quotation which you had at the beginning. He understood the paradoxes that make economies and markets work. The people who are in government right now think that they can just issue things by fiat. Poof, we're going to have a website that works, or poof, we're going to slash costs. And they think it's going to happen without secondary and tertiary consequences. But those of us who live in the real world know there are very, very painful real consequences to these changes.
Jimmy Penderkugis, is this, who's the real culprit here? Because I think somewhere in there the insurance companies are shaving down costs, right? Is Obamacare forcing the insurance companies to do that, or are the insurance companies just making a conscious decision that cost cutting can come out of doctors' hides?
Don't forget that Obamacare came about as part of a sweetheart deal between large insurance companies and the government. I mean, if you look at, for example, whether you want to call it a tax or a penalty that people will pay for not being adequately covered under the definitions of this administration, that money goes to the insurers, to the insurance companies that are going on the exchanges. I mean, if you want to talk about a wealth transfer that is seriously unjustified.
I'm not going to feel tremendously sorry either for the insurance companies. I'm also not in the let's keep doctors' salaries high business. Listen, I think we should have a lot more foreign doctors. I think you could have a lot of people, nurse practitioners, doing a lot more. I think that'll help sop up some of that demand for doctors. But listen, the president could have never have sold this plan if he would have sold it. You know what? This is Medicaid plus. I don't know, maybe it's Medicaid minus. It would have never gotten through. Between doctors leaving the profession, you're going to have these narrow networks, which could end up being, by the way, a ton of lawsuits from people who don't think they're getting proper health care because, A, they can't go to the great local community hospital, and it's too far away, and they can't get the preferred service. So, and then you're going to have potentially huge rate hikes at the end of this year. The thing, it's not looking very strong right now.